Children may seem well equipped to deal with COVID-19, but the pandemic is leaving its mark. School closures and isolation from friends are bad enough, but some kids are forced to face the pandemic alone. Research shows over 1 million children have lost at least one caregiver during the crisis, robbing them of critical support and exposing them to poverty and abuse. Hi, I'm Ben Fazul, and nice to have you along. The pandemic has put some kids in an extremely risky situation, as you'll see in our report in a moment. India's emerging from a deadly wave of infections. It's claimed tens of thousands of lives and created a broken generation. Children and teens orphaned and exposed to not only emotional trauma, but exploitation.
For 9 years now, Preeti Poddar has worked with children from underprivileged communities. On a daily basis, she deals with children who have experienced great loss and are forced to grow up before they're ready. But since the outbreak of COVID-19, their numbers are growing. Children are being made to quit education and take up household responsibilities, and are also being pushed into child labor as their families have lost income. Secondly, since they are spending a lot of time at their home now, many cases of child abuse are also coming up. Having already been disproportionately affected by COVID-19, many children are facing another tragic fallout of the pandemic. Many have lost mothers or fathers or both, leaving them extremely vulnerable. Since last year, the NGO where Preeti works has provided support to 13 children who have been orphaned due to COVID-19 by helping them settle in with their extended families. Sonal Kapoor Singh, the founder of the organization, says that while children who have been orphaned have it much tougher and need immediate attention, a more holistic approach is needed to address every child in distress.
There's a lot of conversation about COVID orphans, but honestly on the ground, such cases are probably 5 to 6%. The other 95% cases that we are looking at is where the very parents of these children are pushing them into sexual trade, transactional sex and child labor. The real issue really is to look at the vulnerability mapping of which child is in massive distress and which child needs more support.
That there is a need for a more comprehensive approach is something that Anurag Kundu, the head of the Delhi Commission for Protection of Child Rights, also advocates for.
I think first 3 things need to happen. One, the schemes that provide financial assistance to these families so that at least a basic subsistence is ensured. The second thing that needs to happen is the governments have to explore ways of keeping the children in school. The third, either ensuring a livelihood for the family or ensuring that they are registered in different existing schemes of the government, could be a ration or whatever, but ensuring that the family has adequate means.
As an immediate urgent step, the Commission has started a helpline for children in distress. Back at the center, Preeti says that many children she meets with are in crisis right now. Because of COVID, years of hard work that we and the children had put in seem to have gone waste. We are now trying to get them back to their studies. And through different activities, we are trying to heal them and help them come out of the difficult situations they are facing. Preeti says that despite their best efforts, it will be a long while before the children are able to cope with the hurt and the trauma that the pandemic has inflicted.
Lorraine Sher is a clinical psychologist and works closely with national and international agencies. She joins us from London. In India, they're talking about a broken generation. Are we seeing this elsewhere?
Absolutely. It is occurring elsewhere, but your question is, are we seeing it? And I think people are not focusing on it, much to their detriment. So for every adult who succumbs to COVID, you would have orphanhood for their children, and even for grandparents, where it clusters in older generations, you have co-residing and caring grandparents. So children are dramatically affected, and we need to sharpen our lens to them.
Just what sort of magnitude are we talking about in some parts of the world?
It's high. We have a paper coming out in the Lancet in a couple of weeks that tries to create a model to quantify it. But it's related to the fertility rates, the size of families, and the burden of COVID. And with that kind of reporting, we are seeing figures globally, probably in excess of 1 million children, and growing and growing. We know in countries where there's high fertility rates, more children are affected, and very often that gravitates to low-income countries. So looking at countries like India, as you say, South Africa, but it's true across the USA, across the UK, in Brazil, many countries across the continents. It's a global phenomenon.
Wow. Another concern is the pandemic's seen orphanages close and children sent back to their communities. What happens then?
That's a complicated story because we know that orphanages are probably not good places for children to thrive. We know this before the pandemic. And sadly, amongst the HIV epidemic, we saw them mushroom, where we do have very good evidence that family care is best for children. So we are looking at programs to close orphanages and to prop up families. For example, in Uganda, there's an excellent program, and in Rwanda. But the planned closure is the very interesting issue. So we could jump now and support the families. We can't let children go unsupported with no resources. And maybe some of the policies on childcare and childcare in the sudden and abrupt absence of adult care needs to be brought into focus with resources. We shouldn't forget that this is a COVID casualty as well.
Lorraine, have we learned anything from other pandemics?
Absolutely. So in Ebola and in HIV and AIDS, we saw this mushrooming of children and this huge vulnerability. We also know that the vulnerability extends lifelong. So once you've lost a parent or a child experience orphanhood, we know that it matters who dies, if it's a grandparent, if it's a mother, if it's a father. And we know that a multiple burden like double orphaning or multiple loss, it bodes really poorly for the child. And we also know the age matters. So the younger the child, the more dramatic the long-term effects. And care responses are crucial. So the immediate care and the ongoing sustained care and all the kinds of disruptions like schooling and well-being need to be plugged if the child is to regain. We also know that if you do put in interventions, they work. So we have to be very cautious of poor quality care, of excesses of violence and abuse of such children, and having national and government-supported good programming with a sharp lens on children.
Okay, Lorraine Sher, there, clinical psychologist. She joins us from London. Thank you very much for being on the show today. Pleasure.
Pleasure.
Time now for our science correspondent, Derek Williams, and a viewer question about how the virus affects young adults.
How does COVID-19 tend to affect young adults?
There are two facets of this multifaceted question that I'd like to talk about. The first is, of course, the straightforward issue of what the virus does physically to an average young adult as compared to someone who's older. And there, the statistics tell a pretty clear story. COVID-19 mortality increases dramatically with age. Let's look at recent data from the US. More than 4 in 5 deaths there have occurred in those over 65, and fewer than 1 in 200 reported deaths have been in people under 30. But as vaccinations rise among the elderly in countries like the US, doctors say that the average age of patients who are being hospitalized with the disease is dropping dramatically, and that many of those younger patients will end up with conditions like crippling damage to the lungs or the heart. So although COVID-19 is a lot less likely to kill a young adult, there are still really pressing reasons to get vaccinated because getting it can have devastating long-term health consequences. The second important facet of this question is the pandemic's emotional, social, psychological, and economic impact. It's affecting everyone of every age, but as experts say, in many ways, hitting young adults especially hard and at a key time in their lives. They're now warning that due to lockdowns and other measures, Generation COVID is facing shortfalls in opportunities for crucial self-development. Many young people are rising to the challenges, but psychologists and other therapists in many places, like here in Germany, are also currently being overwhelmed by this tidal wave of young adults in need of help. And a lot of those professionals now say that even the serious toll taken by infection in today's young adults could in the long run be overshadowed by the impact COVID-19 has on the group's mental health.
Derek Williams there. Keep sending in your questions. Just use our YouTube channel. Finally, some good news for residents of Delhi and Mumbai. The government is easing lockdown restrictions there as new infections in India fall to a 2-month low. Shopping centres are reopening, though with some restrictions in place. Public transport is operating again at reduced capacity. The restrictions came in April after India was hit with its most severe corona outbreak to date, making India one of the world's worst hit countries with around 29 million registered cases. Despite easing restrictions, authorities are warning residents against letting their guard down. Infections may be falling, but COVID-related deaths remain at high levels. Thanks for watching. Stay safe and see you again soon.